Hello, I'm Dr. Aniruddh Kulkarni, practicing neurosurgeon in Hooghly. I consider this as a great privilege to share some of my experience and my views on management strategies in head injury. Head injury, also called as traumatic brain injury, poses a significant health crisis in our country, especially in India and also in developing countries. It is one of the leading cause of deaths in young adults. This is because the young adults are they are the earning members of the family. Hence, it's going to give a major socio-economical burden on the family, in turn to the community, and as a broader perspective, it causes a lot of burden on the country. In India is known for diversity. There is a diversity in religion, culture, landscape, geographical terrain, and also there is a diversity in patient care. So what I feel is there is a need to develop a comprehensive network or a framework in which there is a Indian centered guidelines are required to train the health professionals, paramedicals, so that we can identify the head injury in an earlier stage, prevent it as much as possible, and to give a effective care management. And there is a need for a systematic approach and evidence-based medical care, so that it's been proved that evidence-based medical care in head injury patients or the traumatic brain injury patients gives a fantastic neurological outcome. In turn, it is going to reduce the economical burden. So this is going to make a significant difference to the economy of country. So it's very important to have a proper system in place to treat the traumatic brain injury patients. Coming to incidence of traumatic brain injury in India, the incidence has significantly increased because of rapid urbanization, industrialization, excessive vehicles which have come to the roads, excessive migration. All this have put increase in the road traffic accidents. In a hospital-based survey, there is evidence that 1.5 to 2 million people get admitted because of the head injury patients. Out of that, 5 lakh patients die because of pure head injury. This is a very huge number. And one more important thing is there are very few advanced trauma care centers or which are dealing with this head injury cases. So the case fatality in such institutions are significantly less because of a aggressive type of management, good infrastructure, good resources. But at the majority, more than 90% of the places in India lack basic needs, basic resources, basic health professionals. So there is a lot of scope for the improvement in wider sections of the country. Most common cause of traumatic brain injury is road traffic accident, which accounts to 60%. 60% of the time it is a road traffic accident. In 20% of the time it is a fall during the construction sites or fall during working place, and in another 15 to 20% is because of the assault or violence. Pedestrians, two-wheeler riders, pillion riders, and bicycle riders, they are the most victim causes. Most commonly they are the victims in such scenarios. And the major causes is poor road designs, poor vehicular designs, non-use of helmets, non-use of seat belts. They are the main causes of road traffic accidents. Coming to the pattern of traumatic brain injury, majority, that is 60%, are mild head injuries, 20% are moderate head injuries. Moderate means according to the Glasgow Coma scale. And another 15 to 20% are really severe head injuries which require a team effort, and none of the head injuries are, we can't tell that a severe head injury can be given up. So with a team effort, most of the head injuries can be tackled and effective care can be delivered. Head injury is not an event; it's a dynamic process. To understand better head injury, we divide head injury into two types. One is a primary injury, that is when there is a direct impact on the head. So only way of management is to prevent this. Second one is called as secondary injury. Means after the impact, the cascade of events which will take place inside the brain constitute secondary brain injury. That's after the trauma to the head, there can be excessive bleeding, there can be edema, there can be excessive water collection inside the brain. So there is a raised intracranial pressure. This all constitutes secondary brain injury. Hence, our role as a neurosurgeons and the health professionals is mainly directed towards controlling the secondary brain injury. That is a vital. That is of very, very important. And the most important in management of head injury is prevention of 4H, that is reduction of hypovolemia, control of hypotension, control of hypoxia, that is reduced oxygen supply, and control of hypercarbia, that is increased carbon dioxide retention. Because when patient has a severe head injury, he will not be able to respire properly. So there will be a lot of carbon dioxide collection inside our system, and that causes vasodilatation, and in turn it causes increased pressure inside the brain. So the most important key steps in management are control of hypotension, hypovolemia, hypoxia, and hypercarbia. Overall management can be done in 3 phases. One is pre-hospital survey. Pre-hospital survey at the accident zone. Pre-hospital survey poses a significant issue. In our Indian scenario, we have seen most of the patients who have become victim of head injury or road traffic accident. They will be lying down on the road, and most of the time, the citizens or the people who are going there, they don't know what to do, what next to do, because they are not trained. We can't blame them. We have seen they will be taking the phone and they will be recording. So such scenarios we have seen. So I feel there is a need to improve our awareness, improve our understanding what to do whenever there is a accident, victims are lying on the road. So I feel there is a need to develop a proper system and train the students at the primary school level to enhance their knowledge about what exactly happens after head injury, what you are supposed to do, what is the basic life support you need to do. So this is very important, because once patient is shifted to the tertiary care level from the accident zone in a proper way, and if his blood pressure and if his ventilation, if his airway, everything is taken care, a significant morbidity and mortality can be reduced. Coming to the hospital survey. In hospital survey, the efficiency of the care depends mainly on the trained health professionals and the infrastructure you have, multiple gadgets like CT scans. So unfortunately, most of our taluka places or district hospitals don't have all this infrastructure. So our government hospitals are overburdened because of the lack of health professionals, lack of resources, infrastructure, and private hospitals are quite expensive, so it is not affordable to all the patients. So there is a need for central government agencies to make a proper planning, implement the policy making, financing, and you need to set certain basic standards to start any trauma care centers. And also there is a need to have a good multidisciplinary rehabilitation services. After the head injury patients get treated, most of the patients will end up in having problems dealing with cognition, vision, language. So there is a need to have a good rehabilitation so that patients will improve after the head injury, so that they can be integrated into the society. Hence, traumatic brain injury is an important health problem which deserves global attention, and primary prevention is the key. We need to stress on strengthening the safe and efficient public transport, good vehicular designs, good road systems, mandatory they should use seat belts in motor vehicles, and there is a need to stress on use of helmets both in two-wheeler riders as well as pillions. There is a child restraint system should be there in the motor vehicles. Pedestrian safety measures should be taken. So all these things are going to make a significant differences in prevention of the traumatic brain injury.